Hi, Assalamualaikum, good morning. Good morning everyone, I'm Dr. Luqman, one of the facilitators today. Okay, let me just have some head count. I mean, how many of us today? 1, 2, 3, 4, 5, 6, 11. Is that all?
Expecting another 3 more.
Another 3 more. Okay, never mind lah. Okay, so welcome to today's and tomorrow's course. Okay, ACLS course. Has anyone attended this kind of courses before? No, first time? No worries. Okay, so it's gonna be a 2-day course. Starting today. Today will be a full day lah. Usually until okay, it's gonna be a full 2-day course. Today is gonna be like around 4:30, 5 o'clock lah. And then tomorrow sometimes it can end around 4 o'clock juga. Tapi if everything goes smoothly, it can end a little earlier, maybe around 3 o'clock ataupun 2 o'clock. So basically it's going to cover advanced cardiac life support for adults, because for pediatrics it will be a different course altogether. And then let's just do a little bit of ice breaking lah, Dr. Luqman. This is a picture of me because I like to sing and karaoke performances lah. Okay, so I'm one of the senior medical officers in emergency department here in IDN. Okay, and I'm also under training under Royal College of Emergency. I'm the certified instructor for the ACLS and also PAPS, and I've a little bit experience more than 10 years lah. Okay, let's get to know about you guys as well. Okay, start with Dr. Izzat.
Yeah.
Okay.
My name is Dr. Izzat. I'm the Department of Surgery Training. I'm doing attachment in IGN. The reason this guy.
Okay, welcome. Okay.
My name is Dr. Shikwa. I'm under radiology, nephrology.
I see.
GCI.
JCI juga lah. I mean you're permanent in permanent lah.
Just started.
Alright, welcome.
Morning. I'm the Rwanda from PCAC.
I see.
Some
Sama je ya. Alright, JCI. Fellowship. You'll be here for 1 year. 1 year, right? Just started lah. Okay, welcome. Okay.
My name is Natra.
Natra. Which ward? B202. Nurse kan? First time ke?
Actually, I'm a pediatric nurse, but then I have transferred to the ward that I protected.
Okay, great. Okay, tak apa, welcome. You've done pulse before?
Yeah.
Okay, should be easy. ACL should be easy. Okay.
I'm Nandini from Hospital Putrajaya, waiting for my exam composition.
I see. Welcome. I mean you are apa nama kita panggil. I mean you come like in a group ataupun you come alone? Alone lah. Okay. Okay, welcome.
My name is Gunawati from Dalita, Malaysia. Reason to take is just promoted as a clinical instructor for Dalita.
I see. I mean it's a
It's
medical center.
Neurodialysis center.
Dialysis center. Of course you have experienced some cardiac arrest before kan? Kita tadi share with us nanti macam mana how it went. Okay, silakan.
My name is Mohd from Hospital Sports Service Operation Center. Reason some mechanism.
AJN lah. AJN lah. Okay.
My name is Anita Ismail from the hospital. Reason for the course, sister onco.
Sister. Okay, welcome.
My name is Fiona from Beacon Hospital as well. So reason to take the course, reason actually joining as ICU nurse.
Oh, I see. Okay. I mean you just entered apa nama tu become ICU nurse atau maybe been ICU nurse for some time?
Just entered.
Oh, just entered lah. I see. Previously?
Previously in a general ward.
Okay. But adult lah. Basically handling adult patients. Welcome. Okay.
Hi, morning. My name is Ananda Rubini from Beacon Hospital. Reason maybe my management they had to go attend this course because we are working in specialized unit. I'm from endoscopy, handling patient vaccinations. So it's to enhance more in case emergency.
Right. Have you encountered one?
Had patient post sedation.
Okay, very good. Nanti you share with us further. Okay, next.
Hello, my name is Dr. Mina from Beacon Hospital as well. The reason to take the form because my management told me to.
Okay, sure.
It's a requirement.
Requirement. Tak apa. I mean, most of us are actually here for because of requirements. Kan? Some kind of requirements. Tapi it's good actually because I think the difference between our course and I think the other advanced life support course pun it's gonna be like really comprehensive. It's gonna be like memang guideline punya follow guidelines strictly. Lepas tu can be applied. Memang kita nak you apply pun whatever yang we teach. I mean from our course. Okay, that's one thing. So at the end of this course is our learning objectives. By the end of this course, by tomorrow, you should all be able to, number one, apply the basic life support principles, and then to apply the primary and secondary assessments. Okay, number two is to evaluate the importance of high quality BLS, and it must be applied promptly, including prioritizing early chest compressions, integrating early AED use, and also to recognize respiratory arrest without cardiac arrest. Respiratory arrest is also important, and yeah, early management of respiratory arrest. Of course, we're going to include recognition and management of acute coronary syndrome, and also management of stroke. Okay, signs and symptoms of stroke, and also some a little bit we touch on the stroke management. Right. Also regarding algorithms, we're going to touch on bradycardia and tachycardia, recognize cardiac arrest algorithm as well, and to perform early management of cardiac arrest until termination or post cardiac arrest, ataupun until return of spontaneous circulation. Okay, and then of course how to evaluate kita punya resuscitation. We're not only going to do the resuscitation, we're going to learn how to evaluate our resuscitation, whether is it of quality resuscitation or not. And to everybody will take a chance to actually become a team leader, and the team leader during the resuscitation, and also to become a effective team member, and also to recognize the impact of team dynamics on overall performance. Okay, so our layout of agenda for today. We're gonna start a little bit, I think in 5 minutes. We're gonna start with breakfast dulu. Okay, coffee dulu, morning coffee. Lepas tu we're gonna start back at 8:45, I would say. 8:45 for our first lecture. It's gonna be a series of lectures, and then in between the lectures there will be some practical sessions. Okay, in the afternoon for today it's gonna be kita panggil apa, practical simulation stations, and then we're gonna learn and apply our algorithms during the simulations. Yeah. And tomorrow we're gonna have morning breakfast again, and a little bit of time for practice before we do our exams. Okay. Exams gonna be yes. So how to pass the course? Okay, there will be exams on the practical part, which is the mega code part, okay, the simulation we call it. And number two is the MCQ test, the theory tests. Right? So for the theory test, it's a must pass. Kalau tak pass ni kena repeat. Okay? Make sure you only get 8 wrong answers. So 84% is the minimum. Practical assessment, of course ada beberapa. There's a few. One is on high quality BLS practical, and number two on the respiratory arrest and mega code. Okay? Alright, easy lah. No worries. Okay, for IJN staff, okay, this is where you can get your certificate. You can log on to this IJNsurveillance.r1.info dashboard. Kita ada dia punya QR code nanti. Okay, as you log in, okay, you'll see this interface here, and then okay, and then you need to select. You'll see your name, and then you select show certificate, and you'll get this certificate as this. Also, you can access via your apps, IJN Pulse apps, at the next. And also for external participants, you can access from the IJN CPR website. Okay, as you see, you can log in, select certificate. certificate and courses. Okay, and as you see your first interface, you can see the certificate tab, and can download as this. Okay, this is the ACLS ataupun AHA formal punya training card tu, provider card. They usually will provide it in about 2 months time, lambat sikit daripada mereka. So CPD points will be awarded to doctors as well, and also CPD points A3 for nurses. Okay. Okay, for ni sama juga macam tadi untuk RGN staff. Alright. So for tomorrow, the exam results will come out macam ni in this format. Okay, IC, and then we will show lah which part pass, fail, kena repeat, kena receipt. Okay, yang ni maksudnya NR ni maksudnya ni remediation, dia perlu repeat. Okay, ada beberapa location of AED in case of emergencies, tapi this list is actually for the main building. Yang ni slide ni ada tunjuk yang new building tak? Yang kita punya yayasan.
Ada, ya.
Ingat, okay, tak payah this one I skip. This is all in the main building lah, dekat ground floor sana. Ya, I tunjuk this building. This at the low ground main building, dekat block A and also block B. Okay. So we are at Yayasan Selangor building. Dia separate tau. In case of any emergency, sebenarnya number one you need to call 999 untuk bangunan ni. Kalau bangunan main building, you need to call 8888. So different. So now here is 999 untuk ambulance datang ambil. But if you're looking for AED, the nearest will be at our floor dekat elevator. Okay. So level 13, CPR 40. Also at level 15 and also level 12. Okay, a little bit of housekeeping, kita punya layout. Let's see, toilet, the easiest access will be from the main door, goes behind, ataupun there's actually another door here. On your left, there will be a double door scan, it will lead you out to the toilets and public toilets. Fire exit also go through the main door, and then stairs, use the stairs to exit the building. Parking ticket, anyone parks at kita punya parking area? JN main parking area tak ada?
Yeah.
Ada? Kalau ada? Sorry?
Block B.
Block B boleh?
Block B.
Block B boleh. Okay, tak apa, nanti just live with hand. Okay, kita akan bagi discount berapa ringgit?
RM7.
RM7 discount.
How many? Only one.
Seorang saja? Alright. Okay, has anyone submitted the ACLS pre-assessment results? Ni pun penting kan, this one is very important because in the report will be sent to AHA, they want to see the pre-assessment results as well. Anyone has any allergies? Any allergies to that? Okay. Anyone on vegetarian diet? Veggie diet? Tomorrow. Tomorrow. Okay, thank you. Okay, SOPs usually before this during COVID time, okay, we ask the participants to wear masks, but now it's a bit more lenient. Okay, you can wear or you may not have. Okay, ensure you are able to view certificate at the end of the course. Okay, kindly see the secretary if you have any problems. Okay, by the end of the course, project small will view. Anyone can view your certificate via the channel just now. Okay, now this is later for tomorrow. Okay, that is all for our introduction today. Any questions so far?
Across the United States, survival rates for cardiac arrest, acute coronary syndromes, and stroke vary considerably from region to region.
It's important that EMS, the emergency department, and in-hospital providers work together, not only to deliver better patient care, but to strengthen the chain of survival for future cardiovascular patients.
That starts with identifying the weak points in your system's chain of survival. Gathering data and measuring patient outcomes can identify areas that need improvement.
To deliver the highest quality patient care by using this team approach, there must be an integration of community, EMS, physician, and hospital resources.
This process must focus on prevention and preparedness, immediate recognition of cardiac arrest and activation of the emergency response system, efficient functioning of high-performance teams, including early high-quality CPR with an emphasis on chest compressions, rapid defibrillation, effective advanced life support, integrated post-cardiac arrest care, and recovery.
To deliver the highest quality patient care, integrated systems of care should include in-hospital medical emergency teams and rapid response teams, often referred to as METs and RRTs.
These teams typically consist of healthcare providers with both critical care or emergency care experience and the skills to support immediate intervention for life-threatening situations based on early detection. These teams are responsible for performing a rapid patient assessment and initiating appropriate treatment to reverse physiologic deterioration and prevent a poor outcome.
Some rapid response systems use specific physiologic criteria to determine when to call a team.
The American Heart Association recommends that hospitals establish a rapid response system.
Any case of resuscitation or emergency, there should be a good system of care in place. So, for example, things that has been mentioned by AHA, there should be like a chain of survival. As you know, when you see anybody collapsed, there must be an immediate recognition. There must be an immediate, check for pulse, check for breathing, early CPR, early defibrillation, early call for help, and early transfer to the hospital, and also for good recovery care in ICU, in CCU, and so on. So that's one of the things. For example, another thing that a system that should be in place in any institution should include a rapid response team. I think in IJN we are quite familiar with it. We have the code blue team. It comprises the on-call teams, some other personnel whenever it is activated. So there should be like a proper activation system, a proper team to respond to any immediate resuscitation that occurs. For example, beacon macam mana? What do you think? Beacon punya system. Kalau ada code blue, patient collapse macam mana you guys punya sistem activated? Code blue juga ada.
Isu akan diberikan ataupun dalam masa yang akan diberikan.
Okay, siapa yang datang? Buka.
Nurses.
Nurses, okay.
Nurses is on call and home.
Okay.
Pharmacist.
Okay. Usually I think in your system maksudnya orang tu khas untuk code blue tak? Maksudnya on call, yang on call.
Bukan, maksudnya nurses on duty, tapi TL lah.
Oh, okay.
TL untuk every ward lah.
Okay. Doctors pula?
Doktor, info lah.
MO lah. I see. And MO tu dia on call ke ataupun dia memang standby untuk code blue saja?
MO untuk cover
Operation, cover
Cover
inpatient.
so dia juga MO lah.
I see. Okay lah, slight difference with our system. Tapi whatever it is, we know our own system, as long as it works, okay, tak ada masalah. So other than that, AHA ada mentioned a few tools, okay, with advanced technology ni. Kita sekarang dah encourage the use of feedback response, audio visual feedback devices, for example during CPR, to give us some info regarding how deep we are pressing the chest, how fast we are going, complete chest recall. So the device is there to help us know, to give us some numbers in order for us to improve in the future. Okay, so that is about the systems of care. Moving on to the science of resuscitation.
American Heart Association systematic approach includes 3 components once you have established scene safety and your initial impression of the patient: the BLS assessment, the primary assessment, and the secondary assessment. These sequences combine assessment and treatment components for effective resuscitation. When deciding which assessment to use for a patient, start with a step we all do automatically. Visually assess if the patient is conscious or unconscious. This is your initial impression of the patient. You can form a rapid general impression by a quick visual assessment of responsiveness, breathing, and color to determine the urgency of the situation. After determining that the scene is safe, if the patient appears unconscious, use the BLS assessment. After completing all of the appropriate steps of the BLS assessment, progress to the primary assessment for more advanced assessment and treatment. Finally, progress to the secondary assessment. If the patient is conscious, go directly to the primary assessment and then the secondary assessment, which we'll review in a moment. By following the assessments in tandem with an adherence to the chain of survival, you will more efficiently and effectively assess, diagnose, and treat your patients.
hey. When I say hey, you guys respond ho ho. Just to wake us up, okay? Because it's gonna be a long video, kan? Ngantuk sikit. Anyways, so the topic was systematic approach. Okay, basically we can make it short, like it's a series of asking questions, ticking the checkboxes like the A, the B, the C, D, C, and also ask more questions with the samples, SAMPLE. Okay, let's talk a little bit on how to do this primary assessment. Because we remember from our previous resuscitation, sometimes we want to do everything all at one time. Everybody wants to do everything. So sometimes it's going to be overwhelming. It's going to be and sometimes we tend to miss things. So this structure, the ABCDE, will help you to not miss things and to follow like a flow lah. Follow like a flow. For example, you may have somebody just falls in front of you. Maybe it's out in the park. Okay, so what do we do first? Okay, what did they suggest? Okay, first you use visually dulu. You tengok je dulu. Naturally kan, we see what happened. Okay, we want to see either the patient has got some movements or no movement. We want to see whether unconscious or conscious just based on seeing only, looking only. So first you see, oh, no sign of movement, maybe unconscious. Then you approach, and then you start BLS for example. That is to confirm whether the patient is conscious or unconscious. Sir, are you okay? Then we follow the BLS. If the patient is unconscious, what do?
Call for help.
Yes, great. Get help early. This is just some refresher. Get help early because we tend to miss the getting help part until we do all the CPR, and then you realize you are all alone until the end. So get help early. So once you get help, of course, one check pulse and breathing, and then you follow from there. No pulse, no breathing, CPR. Okay, no pulse, of course CPR. But if there is pulse, no breathing, give rescue breath, and so on and so forth. Okay, that is unconscious. Okay, now when the patient is conscious, okay, maybe looking weak, for example, then you can proceed with the primary assessment. So, Dr. Ahmed, what's the first part of systematic approach? What's A? Airway. So what do we check in airway? Great. Yes. Yeah, you're right. Exactly. Because airway, basically we think about the airway, basically the mouth, the nose, the throat, then nasopharynx, the oropharynx, and the laryngopharynx. Any signs of obstruction. Can the patient still breathe without any help? Okay, meaning no sound of stridor, snoring, all those things. So that is to check whether the patient has got patent airway or not. So that's A, patent airway or not. That's the question. Number 2 is B, breathing. So B is to check for what?
For breathing.
Huh?
Check for breathing.
Breathing. What kind of checking you want to do? Okay, the patient now say not breathing. Okay, no, I can't say that. If the patient is conscious can, but now having like labored breathing, fast breathing. So what else? What other elements of breathing you want to check? Dekat breathing dia nak check apa? Kan, maybe the rate, kan, the respiratory rate, kan, you can count, kan, the rate, or whether visually you can see whether it's using accessory muscles, kan, like struggling, using the sweating with it. Okay. That's the number 2. Okay, if you are in the hospital setting, we can use some pulse oximeter. You can see the oxygenation, SpO2. Okay, and and if you have the devices, you can listen for the lungs, again, the lung sounds. Okay, those are basic things. Okay, so that is B. Okay, how about C? Circulation. What do we cover in circulation? Okay. Great. Betul? Good. Yes. Yeah, circulation is basically about the cardiovascular part. Okay, you can start with the hands also. You can see the colors of the hands. You can touch. You can feel the hands is cold or not. Warm ke, CRT you can check. You can feel for the pulse. If the pulse is weak, Okay, if the CRP is more than 2 seconds, 5 seconds, so you see whether the patient is in shock. So many information, a lot of information you can get from that. Moving up from the pulse, you can check for the BP. Okay, check the BP. Of course, put the pulse oximeter. Maybe you can see a bit of red there. Okay, and going to the face, you can see the pallor, kan, pale or not, jaundice or not. See the lips, see the tongue, hydration, a lot of information. Okay, kalau nampak kering je, nampak macam pucat je, you're thinking of anemia, bleeding somewhere, tak cukup air, all those things. And then you can go to the chest. Here comes the ECGs. Here comes the listening to the heart sounds. Okay, of course there are other details. Okay, in the cardiovascular assessment. Okay, great. So D and E. So D stands for D untuk apa? D itu disability. Disability nak cakap apa? Okay, dia cover apa? What does it cover? Yes. So basically it covers neuro punya part. Okay. Sebab dia nak you check the consciousness level. Dia ada aja tadi pakai A, B, or B, or U. Whether alert or responding to verbal response, stimulus. P, responding to pain stimulus. Or U, memang totally unresponsive. So very easy. Dia tak ajar GCS tau. GCS tu later itu more detail. Dia just ajar nak resuscitation. You nak decide if patient is less conscious or conscious. Okay, A, B, E. Also in D, you can check for pupils. Okay, ada besar sebelah ke kan? Is it blown up, both, fixed ke? All those things can give us some info regarding the brain. Okay, what else? You can also check for glucose juga in the D. Okay, up to you lah. Because the motive says ataupun the point is not to miss things. You want to do everything in structure. Okay, and E. What do we do in E? Exposure. Exposure means what? What do we expose? Yes, basically it's head to toe. Head to toe. Basically you can check for any signs of trauma anywhere. Dia jatuh ke, dia pingsan, ada crack the head, or ada bruise on the back. Anything from the chest, bruise on the elbow, shoulders. Okay, and the wrist. Any active bleeding anywhere. Okay, maybe you can check for any any tattoos, any recent wounds, rashes. Okay, kalau ada meningitis rashes, all those things covered in E exposure. So if we move from 1 to 1A, B, C, D, E, it's going to be like very structured, very complete, and very increased chance to survival lah if we treat accordingly. Of course, if you need more information, do the secondary assessment, which is sample. S stands for apa? Okay, signs and symptoms. So what is the patient having lah? What signs that you can see? What are the symptoms that the patient is complaining? A, any allergies that the patient has before, maybe can lead to that collapse. P, medication history. P, past medical history. L, last meal is quite useful, especially kalau patient going for op, okay, for anesthesia use, kan? So last meal, and E is the events that led up to the current problem lah. Okay, about the same like the signs and symptoms. Any questions so far? Okay, ni masuk exam confirm. What I'm stressing masih masuk exam ni. So they want to ask you what component is A, what component Okay, so next will be on our BLS. How about we talk about CPR coach first? It's quite important, CPR coach. So a little bit on CPR coach. It's actually a relatively new concept. Meaning during resuscitation too, they want to have team leader, they want to have a co-pilot. So the coach will be a co-pilot. Nanti dia tengok apa maksudnya CPR coach.
Product. The following information. Basic life support.
Now, so we have the airway station here. Okay, we have two patients lah. Okay, let's say Ananta dengan doktor, you ada Dr. Munira, you are attending to this patient, for example in emergency department lah. Senang sebab ED ke hospital setting, kita ada lah alat-alat ni kan. Kalau kita kat luar nak practice apa sangat, very minimal kan resources. So Katakanlah at ED, okay, you have this patient. Okay, the patient brought in by ambulance. Was told that the patient was having shortness of breath in the last 2 days, now worsening, so they brought in. So, and then you see the patient now, for example, I give you the situation, like labored breathing, very tachypneic, now sweating. Okay, that's all you see visually. Can? Okay, now show me how you would approach to such patients. Okay, katakanlah ni real patient. Oh, real patient. Okay, what do you do first? Kata dengan ni. Buat je. Katakanlah ni patient ni katakanlah dalam keadaan duduk. He's sitting now. Kan? Okay.
Cik, masih sesak nafas ke? Then you assess whether he's using accessory muscles.
Okay, so the first point Dr. Munira kata ialah kita assess dia punya response dulu. Kan? Simple, basic. Kan tanya, sir, are you okay? Okay, of course lah dia sesak nafas. Kan? Okay, this is the situation. Okay, apa nak buat sekarang?
Alright, can I get a SpO2 monitor on the patient?
Okay, basically doctor is asking for help. Kan? Because she's alone, so she needs help. She needs more resources, more people. Tolong, ada patient in ni cardiorespiratory distress. Respiratory distress. Okay. So dia minta apa tadi? SpO2 ada, nak tengok apa? Oxygen level. Okay, maybe nak letak cardiac monitor kan? Okay, and then of course you nampak somebody in respiratory distress, you want to give okay. Katakanlah doktor nak pilih mana?
I would put face mask terus dulu.
Okay, face mask. Okay, siapa kenal face mask yang mana satu? Okay, this one?
I
This one?
put a face mask.
Okay, this is simple face mask Okay, kata. Alright. Okay, nak tunjukkan macam ni you pasang. Okay, you nak pilih apa? Apa yang ada? Okay. Okay, high flow. Boleh. Mana satu yang you panggil high flow mask? Okay. So sambil-sambil you pasang while you are putting on the devices kan, you see the SpO2 88% under room air kan. So you decided face mask, you decided high flow mask. Okay. Somebody can tell me what's the difference? Apa beza ni? Apa beza ni? What's the difference between these two? Okay. So the point is each can deliver different percentage lah, different fraction, oxygen fraction. Good. So this one can go up to, I would say 96%. Dia tak 100 tau. Even though with the pulse, we won't go 100. This maybe 60% plus. Okay, 60% maximum. This one you can put turn the level tu up to what? 15 liters. 15 liters. Ada yang 30 liter punya, tapi maximum FiO2 dia bagi pun 30 liter pun still 96% kan. So this one if you go 15 also 60 plus percent saja bagi So maybe up to 10%, okay. Alright. Okay, kita tukar orang. Tukar orang Okay, next So health arrives kan. Orang okay, pasal. Okay, so doktor kata, oh tadi patient ni baru sampai, I nak balik dah, I pass over lah. Kan, patient tachypneic, kan, SpO2 88% on room air, now dah bagi oxygen, naiklah 92%, 93% lagi. Okay, so Anita take over lah, Nadira take over kan. So, what do we do now? Patient still tachypneic. Okay, dah, kita dah pasang. Okay, sinus tachy. Kan, sinus tachy lah, 120 kan. Oh, I forgot to say, patient is what, 50-year-old, male kan. Okay, now while we are thinking what to do next, patient suddenly dia macam dah closing his eyes, nampak macam tired kan. SpO2 pula bunyi ping, the SpO2 machine ping, 88, dah on oxygen dah ni, 88, 85%. Okay. Good move. So meaning you need to check again. Kita tak tahu dia dah change in condition, dah ada something or event. So dia not responding to you now. Okay.
Call the
Ada dengar activation ada. Okay, you apa nak buat? Okay, 99 tak payah ni kat hospital dah. Kena kat hospital dah. Kat ED dah. Ni kat ED. This is ED.
call for the help.
Okay, help dah sampai. Okay, AED. Okay, dia dah pasang pads or whatever cardiac monitor.
Check for the pulse and breathing.
Okay, good. Must check lah, kan? Anybody yang unconscious must check pulse and also breathing. So I would say patient ni pulse ada. Okay. Show me how you check for pulse dulu. Just nak BLS sikit. Okay. So nak check pulse. Okay, pulse kita carotid kat mana? Okay. Okay, boleh. Okay, kalau kita rasa kat kita punya pun Adam's apple tu kan, just slide the hand, finger tu je diluk sini sebelum kita jumpa orang otot ni kan, sinuclear ni, you can feel the pulse lah. Okay, right there. So pulse ada lah. Pulse ada, that's pulse.
Check breathing lagi.
Okay, breathing macam mana nak check breathing?
Check for the
Chest rise kan. Patient ni tak ada chest rise lah. No chest rise. Okay, apa nak buat? Panik. Kita panik dulu.
Start CPR and then start CPR lah.
Nak CPR ke? Pulse ada. Jantung dia masih berdegup. Okay, apa nak buat?
Rescue breathing.
So kita kena bantu dia punya breathing lah. We need to help that. We need to give the rescue breath. Tunjukkan macam mana. Okay, first apa position patient dulu? Kita position patient dulu. Tadi duduk kan? The patient was sitting up. Okay, nak position apa yang bagus untuk dia sekarang?
Head chin in.
Okay, kita baringkan dia dulu kan?
Okay.
Okay, dia baring lah. Sebab tak nampak macam kan? Okay, supine dia. Okay. Okay, now you take over the breathing now. Okay, how do you open the airway? Show me. Okay, macam mana you buat head tilt chin lift? Okay, beberapa teknik, beberapa cara. Okay, let me just show you. Okay, one way is just literally the head tilt and the chin lift. Okay, it's one way to do it. Another way, you can put your hands to the side and also slide. Pun okay. Ada orang pegang sini, pegang belakang ni, pun okay. Asalkan you head tilt and chin lift lah. Jadi the chin must go up. Of course, there's another way we call the jaw thrust. Have you heard the jaw thrust? Okay, you put your palm on the maxilla sini. Sorry, and then you pull the jaw at angle jaw, and then you pull up. So macam dia underbite macam tu So kita buka. Itu pun boleh. Pilih lah. Sebab yang itu untuk usually kita reserve cervical injury. Kalau dia ada patah tulang sini, kita tak nak buat macam ni kat leher dia. So kita tolak dia punya jaw saja untuk buka the jaw. Okay, tunjuk. Show me the head tilt chin lift again. Okay. Okay, lepas tu nak buat apa? What do you call this device you're holding? Okay, sebab kadang-kadang maybe dekat ward you nak cakap apa ni, tolong ambil benda tu, kan? Sometimes you call it ambu bag, kan? Sometimes you call BBM. Okay, ambu bag I think it's called. Where are you from, doctor? Sorry? Egypt. Is it called ambu bag there? So all around the world memang dia panggil ambu bag, even though it's a brand name, kan? Ambu is a brand, tapi it's a back buff mask lah, ataupun back mask lah. Okay, so teruskan. Okay, how do you give rescue breath? Kita tukar orang. Change person. Pass over lagi. Satu shift habis. Okay, let's pass over. Okay, come, try. Okay, kita continue from the bagging part. Okay. Okay, usually position kan, the most comfortable, you stand at the head. Usually the most comfortable position lah if you are alone. Okay, few issues here. Actually, the most ideal way to use this is the two-person one. That is the most effective lah. Okay, let's say you get help. Panggil siapa nak tolong? Somebody. Doctor, tolong ni. Ni tolong. Okay, so show me how you do two-person bagging technique. Good. It's the same kan? You use the CE clamp technique. C and E. Okay, C. Tengok ni. C. You send, good. Okay, and then this finger kan, you grab the jaw. Don't grab the neck, grab the jaw, Yes, while maintaining the airway open. Okay, while the other person back lah. Okay, try and back. Okay, what do we expect to see now? Chest rise. Let's say you are struggling. Even though this person, you don't feel, you cannot, it's like there is resistance. Whenever you press, there is resistance. The air is not going in. What are you thinking of now? Something is blocking the airway. What is usually blocking? The tongue, That's it. Ni soalan bocor. These are all the leak questions for tomorrow. Okay, so the tongue is the most common reason for the blockage. So what do we do now? Okay, show me how you choose the size, and show me how you insert. Okay, from where to where? Tunjuk size dulu. Macam ni you nak measure.
Sini ke sini kan?
Okay, so the angle of mouth ataupun to the angle of jaw. Sebab benda ni, okay, do you know why we measure that way as such? Because you want to see the thing rests dekat sini tau, just above dia punya epiglottis tu. It's like usually it's like hanging there. If you go for a smaller one, sometimes it can just go here, sometimes it can be blocked by the tongue itself, so not good. Or too big. Too big also, sometimes you go to the esophagus instead of the sini, the trachea tu kan, glottis tu. So, go find the correct size, which is angle of mouth to the angle of jaw. Okay, so jawapannya, the answer for this mannequin is the green one for this mannequin size lah. Okay, now show me how you insert according to the video then. Okay, so of course this is how the video shows how to do it lah. There are a few other ways. You can put it sideways. Okay, this is just a small skill lah. Usually I call it the mini love technique kan. I put here, so I can open the mouth. One way is to do it from the side also, boleh, and then turn according to the curvature of the airway. So maksudnya macam ni, pusing macam ni pun boleh. Tadi the initial way you put terbalik kan, on the hard palate first, and then you turn around 180 pun okay. Another way pediatric usually use that is to use the tongue depressor, meaning press the tongue straight away, no need to turn, straight away home like that, dan pun boleh. Okay, you choose one way lah. Okay, so katakanlah this is inserted already. Okay, inserted already. Boleh. Nanti boleh practice. Dia tolak macam tu. Okay. Yes, well done. Okay, so and then you see a lot of secretions now. Like flooding the mouth. What can we do? Okay, what suction do we have? Okay. What do you call this in Egypt? I mean, we call it, well, if you call for suction, they will go for this one. Yonker kan? Yonker. Well, the American way they say, young cower. The American, they say, young cower is the name of the kind. Young cower suction. Okay, young cower suction, please. Okay, show me how you use it. Okay, alright, okay. And then, do you notice there's a outlet there? Ada lubang kan? You must make sure you close it. And of course, where do you connect this end? Okay, do not connect to oxygen tau. Most people panic, they put to oxygen port. Okay, you see there's an outlet there? Okay, and know this, there are other brands ataupun other manufacturers, they produce suction without an outlet. It's like a straight tube. Meaning, you on kan, you connect, dia memang continuously suck lah. Just like that only. Okay, this one got outlet, then you need to block in order to suck. Okay, that's all. Suck tu basically you can go to the back pun also boleh. Okay, to the side pun okay. How many seconds do you suck for?
Less than 10 seconds.
Maximum 15 seconds. Less than 10 will be best lah. No need to suck too much. Dia akan cause hypoxia. You suck all the oxygen out. Okay, so you done that. Okay, now show me.
The question is what the reason so to control or?
Yeah, actually to control the suction whenever you want to do. Maybe while inserting you don't want to suck yet. You want to focus at the back there maybe. Once you reach, then you suck. Something like that. Well, easier lah. Okay, according to preference. Okay, now show me how you bag again. You done the suction. Okay, the 2% technique tadi. Okay, make sure the mask size is appropriate, covering the nasal bridge, covering the cheek, and also below the lower lip. Above the chin, below the lower lip. Okay, good. Okay, remember the patient is not under CPR now, right? So you're giving rescue breath. Okay, how much of a rate? How fast do you breathe? The answer is every 5 to 6 seconds. For adults, ingat tau, masuk exam. Confirm, 5 to 6 seconds you back one. So how do you do it in real life? How do you do it? You must count. It's either you look at the 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds, 6 seconds, 1 second you back. 2 seconds, 3 seconds, 4 seconds. Okay, good. For each breath you press to how many seconds? for each brand. 1 second. So meaning 1 second, 2 second, 3 second, 4 second, 5 second, 6 second, or 1 second, 2 second, wow. Okay. Okay. And then how long would you do this for? 1 second.
2 minutes.
Yes, actually for 2 minutes lah. And then what do you check? What do you do after 2 minutes? Yes. So you need to go again. Pulse and breathing, because anytime patient can go into a rest. So we don't want to, be distracted. You must check every 2 minutes. Okay. So far, any questions? Okay. Belum habis lagi. Of course, we don't want to do this forever, right? What is the next ataupun the gold standard for maintaining airway? Intubate. Okay. So we don't teach how to intubate in this course now. It's a different course. We don't teach how to intubate, tapi at least we cover the basic management. At least the patient must be under this bagging. Okay, by us lah. Of course, I want to show you the end-tidal CO2 device. This is the one that is connected to the defib machine. It's another now technology. No need the ventilator. Defib machine also have already. So you connect this. Give me that. Okay, you disconnect. Okay, and then you can put here and then connect the bagging. Okay, the bag. So even if the patient is not intubated pun boleh. Kan sekarang dah boleh letak ni. Katakanlah you bagging kan, and then you tengok the end-tidal CO2 suddenly crash. What does it mean? Maybe the patient in a rest. Kan? So what do? You check pulse, breathing, just confirm. Okay, no pulse, start CPR. So ini dia macam cheat code lah. Even you tak wait for 2 minutes, you already see the monitor. Why get suddenly flat? It's supposed to be like hills, up and down kan? Now it's going down like that. Meaning no CO2 is produced. Meaning the heart has stopped. Okay, check pulse to confirm. Okay, CPR.
So by standard every jadi nak sekarang.
Nanti kita tunjuk. Okay, IJN, we are moving towards this. Now, ini memang dah pakai lama. CCU belum lagi, critical care belum lagi. Wards, some ada. Siapa ada ward? Wards ada yang dah ada. But nanti the whole IJN kita tukar with this specific brand lah, Zol brand lah. Of course, other brands about the same technology. This one is the Zol brand. So get to know about this.
Universal, semua boleh muat dekat.
Betul. Dia punya ni apa nama tu, adapter ni. Yang this adapter tak boleh cabut. Ada yang jenis lain boleh cabut pasang. And of course ED kita ada yang mobile punya. Mobile, even if there's no wire. Kan yang dekat situ ada screen. The small one has a screen itself which can show the 3,000 satu. 3,000. Tapi this one is I think less sebab dia come with the review machine lah. Okay, that's the costing. Any questions?
Just show me the jaw thrust.
The jaw thrust, sure.
Idea how.
Okay, put the hand here. Okay, you assume there is a cervical fracture kan? You don't want to move too much. So the position should be like flat. Flat. Somebody will be holding the airway like this on the other side. You are attending to the airway. So you want to open the airway. You put the hand here. Your fingers touching the jaw, the angle of jaw, and then you push the jaw up. You see the jaw moving forward. Okay. So to create the space there, you see. You see. Now it's closed. If you move jaw thrust, open a bit.
So the one yang stabilize the itu akan dapat
From this side. From front. Itu tajuk trauma lah. I mean, trauma is different ni, tapi macam tu lah. Kan because yes. Okay, ready for a quick test? Just give me your ni. It's simple. We're going to do the same ni. Tak apa, I'll do it. This one. Okay, so doctor want to go first? Okay, who wants to go first? I do 2 persons together. Okay, who wants to take this patient? Boleh boleh. Come. Simple je. Macam tadi je. Okay, ED setting. Ambulance comes rushing in, bringing in a patient. Seems breathless. Okay, lady, 70-year-old. So what do you do? Patient now arrive in resus.
Mrs. are you okay? Are you okay?
Oh,
One okay, good. Like tanya.
no response.
No response. Okay. Then check pulse. Release together. Any pulse, any breathing?
There is pulse for both. There is no breathing.
No breathing. Okay, we can start rescue.
Okay. Do you notice anything?
Tak call for help.
Yes. Anybody call for help?
I believe so.
Ah. So let's do it again. Mesti call for help. Mesti. Okay, again. So patient arrive in resus. What do you do?
Mrs. are you okay?
No response.
There is pulse, no breathing. Help, please, help.
Okay, okay. That's acceptable. That's acceptable, meaning you check pulse and breathing first, okay? As long as you get help. Okay? So there is pulse, no breathing, help is called. Okay. So what do you do now?
Patient, we're gonna start like mask first. Okay. Boleh tolong ni tak? I pegang ni punya mask. And tolong pasang SpO2 monitor. Put the patient on monitor, please. Okay.
Okay. SpO2 just starting ni 90%. 90% now.
Continue your vacuum steps.
Okay, you are experiencing resistance while bagging. Show me how you bag. Tak kisah, 1%, 2%, you can count. Okay, say you are experiencing resistance while bagging. What can you do?
We have to check for airway.
Okay, what do you do?
Use airway. Okay,
Okay, there's no foreign body in the mouth. Okay, you want to go for the device.
Selection of the proper size of the
Yeah.
airway.
Yeah.
Okay.
Okay.
Alright. Okay. Okay again.
And then
Continue vacuum.
Okay. There's a lot of secretions now filling up the mouth.
okay, suction please, suction please.
Suction ready? Okay.
Boleh pass to Dr. Munira.
Suffer boleh.
Boleh. Alhamdulillah. Okay, selesai. Okay.
Suction is done.
Maximum 15 seconds suction.
Okay. Okay, now show me how you give good effective rescue breaths. Okay, I want you to count aloud.
1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 4, 5, 6, 7.
You must actually follow like Dr. Wat does. Real time 6 seconds. Must be real time. Kenapa? Oh. Itu included in the 6 seconds. The 1 second is included in the 6 seconds. 1, 2, 3, 4, 5, 6, 1, 2. Okay, do it.
1, 2, 1, 2, 3, 4, 5, 6.
1 is included. 1 is included in the 6.
1, 2, 3, 4, 5, 6. 1,
Okay.
2, 3, 4.
How long would
5,
you do this for?
2 minutes. 2 minutes.
2 minutes.
You check again.
What do you check for?
Like pulse and breathing.
Okay. Yes. If there is no pulse?
So cigarette.
Oh, that's all. Okay, pass. Okay. Don't forget to write your name. You can move to the BLS station, right? Okay, mari. Boleh tunggu dekat luar BLS station tadi. Okay. Okay, same setting juga, ED setting juga. Ambulance datang, bawa aunty. Wah, susah nafas. Okay, sudah masuk dekat resuscitation room. Okay, apa nak buat?
Auntie, are you okay?
Okay, no response.
Call for help. Check and check the breathing and pulse. Okay, check.
There is pulse, ada pulse, tapi no breathing.
Okay, start dengan elbow back. Kita breathing, baca rescue breathing. Yeah, bring back dengan rescue breathing.
How do you open the area?
Head into
Show me how you do it.
Inhale, chin.
Okay. And then proceed.
Proceed. Okay. 1, 2, 3, 4, 5, 6. 1,
Oh,
2 seconds.
you are experiencing resistance, no chest rise, what can you do?
Check the airway. There's no.
From outside, you don't see anything. Okay.
Put the airway.
Okay. How do you measure the OPA?
Here the corner of the
Okay.
from the mouth to the mandible.
Okay. Now insert.
Insert. And continue the steady.
Mhm.
1 second, 2 second, 3 second, 4 second, 5 second.
Okay. There's a lot of secretions. No chest rise already. There's a lot of secretions.
Suction. Suck all the secretions. Suck already. Continue again. Suck. 1 second, 2 second, 3 second,
Okay.
4 second, 6 second.
Okay. Do you think there is chest rise? Okay. What are the things that you can adjust to achieve chest rise?
2% help.
Yes. Get help. Always get help. If you cannot do 1%, then you do a 2%. Okay.
Okay.
Okay. You see. Look here.
4 second, 5 second, 6 second,
Okay.
2 second.
How long would you do this for?
2 minutes. Then
Okay.
check pulse and breathing again.
Okay. Check apa?
Check for the pulse and
Breathing. If there is no pulse.
CPR.
Okay. That's all. Okay, we can bring to the BLS station. Okay. Okay, betul. Okay. Kita tukar sikit. Kita dalam ward pula. Okay, dekat dalam ward. Patient nak discharge ni, baru buat angiogram. Nak discharge, tiba-tiba dada saya berat lah, berat. Katakanlah ni uncle 50 years old. Okay, what do we do?
First kita berespon. Dia punya respon macam mana? Check respon. Okay.
No response lah. Saya nak dah. Tadi dia panggil lagi kan, dia sampai dah tak ada respon. So what do you do?
Selalu check berapa sesi.
Okay, pulse ada. Macam mana awak check pulse? Awak pegang pulse kat mana? Okay. Pulse ada tapi tak ada breathing.
So start dengan betul resiko.
Okay. Awak perasan something tak?
Tak ada, kami tak tolong.
Ulang balik. Ulang balik. Ulang balik. Okay. Okay, start balik.
Are you okay?
Okay. No response.
No response.
So check for pulse and
Check
breathing.
for the pulse and breathing.
Ada pulse ada, but there is no breathing lah.
Okay,
So,
ask
call
for
for help.
help from team.
Okay.
Help. Okay, so and then start for rescue breathing.
Then for
Okay.
rescue breathing.
Sambung pulse oximeter.
Okay, what's the position you need to take for the patient?
So
How's the
forward.
patient's head position?
Supine.
Okay, and how do you? Okay,
First one, then
yes.
head to chin.
Head to chin lift. Okay, how do you do head to chin lift? Show me. Head to chin lift. Head to chin lift. Okay, boleh. Alright, and then?
And then forward the
Yes.
2, 3, 4, 5, 6, 1.
Okay, now you are struggling. Memang tak ada chest rise. What can you do?
So consider for anyone inside the way. So they pop, check for the size from the mouth to the mandible. And then okay, so masuk
The other way.
pop.
The other way.
macam ni.
Okay, paru-paru kat mana? Awak nak tuju kat mana ni? Ni kat otak dia ni.
Sini.
Dia punya paru-paru kat mana? Ni paru-paru kat sini. Okay, so awak punya curve ni nak pusing ke mana? Gitu measure. Okay, so measure sampai angle ni. Okay, alright. Cuba insert. Macam mana video kata insert tadi? Okay, alright. Lepas tu a lot of secretions in the mouth.
Start for secretion, suction, pre-suction. Sub for the secretion.
Okay, so a lot of secretions being cut. So what do we do now? Apa nak buat?
So start.
Okay, now you show me 1% technique pula. Okay, macam mana nak improve? Okay. Okay, macam mana nak improve chest rise? Okay. So usually we need to make sure no leak Usually leak kat tepi tu biasa. Leak usually kat sini. Sebab tangan dia kat sini, dia biasa terjangkit. So make sure dia tengah-tengah. And then you can have a better chest rise. Okay?
1, 2, 3, 4, 5, 6, 1,
Much better. Okay. Okay. So how long would you do this for?
For 2 minutes.
After 2 minutes,
Check for the breathing and then pulse.
if there's no pulse,
Start CPR.
Start sini.
okay, good. Thank you.
Kalau yang
Mm.
one breath every 6 seconds kan, okay, ni kan 1, 2 second, 3 second, 4 second, 5 second, then 6 second baru tekan.
Tak. Lepas 6 seconds, 1 second balik. 1 second tu dah tekan.
Oh.
1 second tu termasuk dalam 6 second.
Termasuk dalam 6 second.
So
Senang.
kita press every
5 second boleh. Every 5 to 6 seconds lah. Usually I teach. Lepas 6 seconds, kita balik ke 1. Yang 1 tu kita tekan. Boleh. Okay, now, sir. Okay, you are in the, katakanlah kat mana? Emergency lah. Katakanlah emergency, you are helping out. And then suddenly, patient dia orang bawa masuk sesak nafas. Apa boleh buat?
Hello, are you okay? Are you okay?
Okay, patient dah tak respond lah.
Okay, I ask her first. Okay, first. Okay.
And then you want them to bring what?
Huh?
You want, okay, get help and then ask them to bring something. Bring what?
Yeah.
Bring apa?
AD.
AD, good. Okay, next. Lagi?
After that, I check the pulse.
Pulse.
Okay.
Okay. And breathing. Okay. There's no, there is pulse, but there is no breathing. Oh.
Okay, so I go.
Okay. Okay. Good. Try. Okay. So what's the correct technique? The CE technique. So where do you put your fingers? Here. And then this you grab what? The jaw.
Okay.
Good. Okay. Let's say you don't have good chest line like this. What can you do?
Try to use the.
What do you call this?
Forgot already.
Oropharynx airway.
Oropharynx airway.
Oropharyngeal airway lah. Oropharynx airway lah basically. Okay. So how do you insert? How do you measure first?
Measure.
Good. Okay, good.
Then I'll try to open.
Yes.
Okay.
What's the correct way? Yes. Okay, good. Okay, there's a lot of fluids in the mouth lah. What can you do?
That's right.
Okay, you must do section. Done already.
I already play the video lah.
Play the every video.
Then straight to practical.
Okay, you must cover this.
Hold.
Okay, dah. Okay, now try again. Okay, how long would you do this for? 2 minutes. And then what do you check?
Pulse.
If there is no pulse,
Pulse and breathing. No pulse.
if no pulse kan, you need the heart stop already. So what do you do? CPR. Yeah. That's all. Okay, good. Very good. Okay, can move to the BLS station. Okay, tomorrow, everybody will be like that. Boleh. Okay, so as you can see, of course lah, high performance team tu it doesn't work only with one person. It's a team. Team leader also bagus, ada coach ni lagi, dengan semua ada players nurses, okay, ada yang supportive pun yang bawa relative juga. Tapi it involves multiple components. Number one, of course, the team leader ataupun the resuscitation team must follow the algorithm nicely. So meaning algorithm must be mastered by all. Semua tahu what's next, what to do next, and then after this, what happens next is that. Algorithm. Number two, of course, there are some techniques they mentioned. Ada pre-charging technique yang kita akan buat. Yang before 2 minutes kita ada pre-charge siap, okay. The hover technique, okay, hovering before shocking, and then resume compression. Of course, there is also switching of the compressors, must be done every 2 minutes, okay. What else? Yes, communications during resuscitation is paramount. Instructions must be clear. If not clear, must be repeated. If the team leader asks for something else, but the receiving end hears something else, what do we do? If you notice that difference, maybe you are the third person. So what would you do? Kalau something else is ordered, but different thing is brought to the patient. So what do? You must intervene now. see a mistake is about to happen, oh salah ubat tu, different medication is ordered. So must clarify, must intervene. Okay, so what other things? Of course, regarding the team members, if you are ordered to be in charge of something, airway for example, but you are not skilled enough, or you're not trained enough, so what would you do? Would you just keep quiet? Would you highlight? Okay, the jawapan is, not sound lucu. Jawapan is, you ask for a new role. Meaning jangan lari from the research station, and do not act that you know. Okay, you're pretending you know, begging, you pretending you know how to intubate, you're not. Just mention, I'm not skilled enough to do this, can I do something else? Which maybe I do this, and then the team leader would know and change you, replace you with somebody else lah, and you do something else. Okay, so all those things are very important. Debriefing is also part of the high performance team as well. Any questions so far? How to perform a high performance team? Okay, of course in real life, you either, because you are on call at different dates with different persons, code blue comes, everyone like different faces, so you don't know your team, for example. So you must make sure who takes in charge, who becomes team leader, coach, and the team members. Communication between that must be professional, mutual respect, and clear instructions. Okay. Any questions? Ready for break? I think we stop here first. Pukul 2 o'clock we'll start here. Okay, 2 o'clock. We have lunch ready. Okay. Solat, you can go to the main building. Solat ataupun level 3. So go right? Okay, ada surau. Okay, let's take a break. No, don't worry, because I think the practical session is because tomorrow morning you still have practice. I'll be here. Oh, I see. What time? I think it will be that. Okay, thank you. They're coming in 2025, but it's not yet released. They said end of this year or early next year. Because you know they bring the new books. We know some of the points that they want to change. We know already as instructors they updated us already, but they haven't put in the books yet. Some things that they tweak and won't change regarding the targeted temperature management, regarding other options, for example, ECMO, CPR. They want to include that, meaning CPR, ECMO. They may advance, but they want to put that in the guidelines. So what else? But mainly still the same. The doses, the flow of the algorithm is still the same. Few just small ones. They said they want to update. Okay, thank you. Okay, just let's go through the post ROIC care lah. Post ROIC care, for example, the patient, okay, you managed to get pulse. Okay, so the sign of ROIC is breathing can be, but usually it's the pulse, because when the pulse is present, sometimes breathing cannot be present also can. So the pulse is the key for ROIC. Even though pulse 2 if weak also consider ROIC. Okay, like I've got pulse but weak, ROIC. Now what do you do after ROIC? Meaning you need to try to get the patient not to become arrest again. Meaning you maintain the airway, follow the ABCD lah. Make sure airway is patent, intubate if you need. Intubate, A. B, the breathing of course is either you manual bag or you put on the ventilator. Okay, make sure the SpO2, how much SpO2 target post ROIC? 92-98. Ini masuk exam confirm 92 to 98%. Okay, of course, next will be the put on the waveform capnography. So few things in A and B, make sure you intubate, make sure you SpO2 92-98, and you put on waveform capnography. Okay, this is standard answer. Okay, so that's A and B. How about C? What do you check in C, post RIC? Okay, so basically again, few things in C, blood pressure, ECG. Okay, so blood pressure if low, you can give some fluids or vasoactive drugs. ECG, depending, ST elevation ke, no ST elevation. If ST elevation, I mean, what's your best plan? Next. Reperfusion. So we need to think of reperfusion either by PCI, and usually PCI is chosen. Yeah, so that, and what else? Fluids if you need, transfusion if you need, if it's really a bleeding case. If you can offer for echo lah, just offer echo lah. Okay, I like to do echo lah. Usually I do that. Okay, and then D, disability. What do you check in disability? Post ROC care. Neuro kan? Okay, what do you check in neurological deficit? So we want to check consciousness level. So basically, sir, are you okay again? Okay. Of course, most of the time comatose, but do not be surprised. Post ROC care patients can be alert conscious. So if patient is comatose, can sir, are you okay? Okay, no response. Then you can go for targeted temperature management. What's the targeted temperature? 32 to 36 for 24 hours. That's a standard answer. So I like to start targeted temperature management, or TTM call it. 32 to 36 for at least 24 hours. Okay. And then okay, you can also in D, that reminds me of either I want to do CT scan, EEG. Later you just mentioned that. Okay. Now in E, it's just head to toe post RIC care management, meaning you can prop up the patient, you can put Ralph tube in, you can give PPI, meaning like upper nexium ke kan, because they tend to have ulcers and what else? Yeah, so CBD in if you want, you can just mention lah. You don't have to show here, just mention. VTE prophylaxis, thrombophilaxis like Lexane for pregnant, because patient usually will be intubated for a long time actually. So you can prevent DVTs. So maybe we offer VTE prophylaxis, for example. And where do you dispose patient, critically ill patient? Where do you send the patient? Yeah, critical area, either CCU or ICU. You just mentioned lah, like to admit patient to CCU area or ICU. Okay. Usually that's the end of the post RIC care. A, B, C, D. That's how you go. Okay, who wants to be the first leader? Kita practice.
I think alone I have to check the consciousness of the patient after 48 hours.
Okay. Okay, that is beyond our coverage of lesson today. But usually in real time, in real life, usually they would do prognostication. For example, patient is being intubated, maybe sedated or not sedated depending on the patient. But usually within 72 hours, they want to check whether the brain is still functioning or brain death is already ongoing. So they want to do prognostication, they call it. But this is beyond our lesson now. Tapi okay lah, good question. So what they would do, they would stop the sedation first. They want to see whether the patient is waking up or not. So they stop the sedation at least for 24 hours, if I'm mistaken. So off the sedation at least for 24 hours, meaning off the system. They want to see whether the patient is waking up or not. And then they will do some tests. They put some eyes in the ear, they check the reflexes, they will do the EEG sometimes. They want to see brain waves there or not. They want to see whether brain death is there or not. And then they will say, oh, the patient's already brain dead. Then they will do what? Further things lah, like organ donation kan, candidates or things like that. That is beyond our lesson lah. Today is only covering until post RIC care, that's it. But that's in real life lah. Okay, okay. So who wants to go first? Okay, today I'll give more time lah. We will practice 10 minutes each. I want you guys to do the best you can, cover all the algorithms. Usually akan ada shockable and non-shockable rhythm. Post RIC care, 10 minutes stop. Okay, kita try. Who wants to go? Okay, balik kan? Okay, semua akan buat pun. Everybody will do. The situation is about yesterday. About the same. Okay, so Nadira. Nadira is in the emergency department. Ambulance bringing a patient with chest pain. I'm short enough, right? Patient is 50-year-old gentleman. Itu je info you have. Okay, so now the patient arrives. Okay, one more tips before we start. I would suggest before we start kan, got two ways of doing it. For example, one is either you assign role beforehand, or you check the patient first and then you assign roles. Up to you. Depend on which one you choose. So for example, when I give you the case, you can ask the instructor, okay, can I just assign roles first? Okay, can you become the airway? Can you become the circulation in charge? You can become compressor. You can be the coach. Can you do recorder? Something like that. Kita tak ada ni. Kan? No need lah kan? No need lah. No need lah. Tapi as long as you show me you are this. So because there's assigned team member roles mark here, so we need to see you assign team member roles. Okay, and then you proceed lah. Says okay. Start. Okay. Ready? Okay. 10 minutes starting now.
Okay, can I assign them a role?
Yeah.
Okay, you in charge of the recorder, you in charge of the medication, compressor, and also for the defib. And you are in charge of the airway. So there's a patient coming here.
Yeah, there's a patient here.
From ED, ED. The patient is having chest pain. So sir, are you okay?
Yeah, really pain in my chest, so heavy. Can you help me?
Okay, so I will put on the cardiac monitor, put on the SpO2 monitoring, on the defib.
So you need to put on the cardiac monitor. Yeah? Somebody must do it. In middle, I usually don't do anything. Just ask the team member. They have the manpower.
Okay,
so busy.
The SpO2 is 93. Can give face mask up to 5 liter. And then the reader now show is ventricular tachycardia and the BP is low, means unstable BP. So I would like to start CPR now and prepare for the defib.
So painful, my chest.
Okay, I can prepare IV epinephrine, but don't give yet. 1 mg. Can someone start CPR? Okay, check for the pulse.
Yeah, there is pulse. There is pulse.
There's a pulse, no need for CPR yet. Okay, can start with synchronized cardio.
You do it. Saya diam je. You just do it.
Okay, can give morphine. Can prepare for synchronized cardio.
Given.
How much can give synchronized cardio?
Yeah. Press again is sync. Yeah. Yeah.
So I clear everyone's clear. Shock is given.
Check. Okay. Now patient is fitting in front of you.
Check for the pulse.
No pulse.
No pulse. Okay, start CPR. Someone can give
Check head. Push harder.
How about patient SpO2?
Unrecordable.
Okay,
Push harder.
Can someone give baking? Baking. Patient now shows VF.
Push harder.
Fibrillation. Can someone
Push harder.
prepare for defib and you prepare for IV epinephrine 1 mg.
Ready?
Okay. can give
Push
refill
harder.
now.
What je? You don't have to say. Tak apa. I know whether you know or not.
Push harder.
You show me. Just do it.
Okay, stop CPR. I clear, everywhere is clear.
Clear. Don't touch.
Shot is given.
Okay, check pass. Check pass. Okay, come. You check pass. Okay, you can do that. You need the signal is
Clear.
clear.
I clear, everywhere is clear.
Okay, resume.
Shot given, continue CPR. Continue begging.
Check patient. Push harder.
Actually stay in
Good compression.
BF. Can prepare for another epinephrine.
Continue.
Okay.
Continue.
After 2 minutes already.
Push
Oh
harder.
yeah, continue first.
Push harder.
Can someone prepare for intubation?
Push harder.
Can you give epinephrine now? 1 mg.
Push harder.
15 seconds to 2 minutes.
Given.
Prepare for defib.
Check patient.
Can press charge. Five, 4, 3, 2, 1. 2 minutes.
Okay. CPR. Shock is given. Using CPR.
Must say clear before you shock. Must say
Push
clear.
harder.
Continue.
Clear BF.
Push
And
harder.
then we can prepare for aminodaran.
Good compression.
200 mg.
Push harder. Push harder.
Okay, can someone take ABD for this patient?
Good compression.
Continue.
Continue CPR.
Push harder.
Taken.
ABD taken. Can
Push harder.
someone give the aminodaran now? 300 mg.
300 mg. Motion.
Push harder.
How about the ABG result?
Not yet.
Push harder.
Not yet.
15 seconds to 2 minutes.
Prepare for the shock.
Remember, with charge, you put your finger.
Check for the pulse.
Okay.
Pulse.
5, 4, 3, 2, 1. 2 minutes. Switch.
CPR.
Over.
Over.
No pulse or there is pulse?
Here.
Can you feel pulse?
No.
Okay, no pulse. What's the rhythm?
The rhythm now is still we are.
So what do you do? Clear?
I clear.
Clear?
Everyone is clear. Shock given.
Okay, resume compression. Macam tu. Situ je dia punya flow. Okay. Continue.
Push harder.
So aminodaran was given
Given.
Aminodaran was given after how many shots?
Push harder.
2. Second is epinephrine.
Third shock.
Okay. Okay, how do you want to check? You check the bottom. Okay, good.
Push harder.
Okay. So what's wrong with the patient?
Patient is having.
Why?
Yeah.
Why?
Push harder.
Find the reversible causes.
Push harder.
Which are?
Yes.
Sebutkan semua.
5 to 8 diagnostic hypovolemia.
Alright.
Hydrogen ion.
Okay.
Push harder.
Hypokalemia, hyperkalemia, hypothermia.
Push harder.
And for the 5 T's,
Okay.
toxin, cardiac membrane, patient is not alive. Coronary thrombosis, carbonate thrombosis.
Okay.
Push harder.
15 15 seconds to 2 minutes.
Okay, someone can stand by
40
for
harder.
the switch conversion. Please switch stop the
5, 4, yeah. Hang on lah. Sorry.
please stop CPR.
Belum nak ayat. 5, 4, 3, 2, 1. 2 minutes.
Check for the pulse.
Can you feel the pulse?
No.
No pulse. So, what's the reason?
Assistor.
So, what do you do?
Start CPR.
Okay.
Continue CPR.
Alright. Okay, so what do you do with the machine? The machine is already primed for shock, kan? So what do you do now? You can press the button, either the energy select or there is down there, you see disarm. No, down there, I want to show you. The yellow disarm, kan? The yellow. This here? You can press disarm. Disarm means cancel the thing.
40 harder.
So 2 ways of doing it.
40 harder.
The second way. Okay, so the first way just now there was disarm. So you can press that. Or you can just energy select up or down.
40 harder.
This machine can, the
40
others cannot.
harder.
This machine can, but the others cannot. The others don't have the pointer. So I just dapat continue, habiskan dulu.
Counting the CPR time is
40 harder.
Yes.
New features?
Actually, it depends because this one I think has the CPR reading here. I think the others one don't have. The old one don't have. So this one, yeah. That's it.
40 harder.
It's about how many thousand? I think
40
because
harder.
I didn't invest about million only for the machine, for the whole of it. Okay, now 15 seconds to 2 minutes. Okay, kita try habiskan 15 seconds to 2 minutes.
40 harder.
Jadi fokus. 15 saat lagi nak buat apa?
Check for the
15 seconds to 2 minutes.
engine epinephrine.
Okay. Bagi tahu dia.
40 harder.
Given
5.
40 harder.
Okay, 5. Kita nak pre-charge.
So after that you will never forget.
You'll never forget. You'll never
What
forget.
are you doing?
Yeah. So you can try. I don't know what to do. CPR now. What are you doing? I just having chest pain.
Now maximum days.
Now maximum. Okay, that's how you remember lah. Good. Lagi from your side. You see. Okay, let's quickly look at your algorithm. I mean basically we covered mainly the main things lah. Okay. Rhythm BT cuma tadi unsure nak defib ataupun nak synchronize. Okay. You must decide synchronize juga stable Okay, fitting. Usually fitting is a sign of arrest. Usually lah, fitting or patient unconscious, sign of arrest usually. So you need to double check. So fitting, no pulse, which was BF. So you CPR first, and then you, I mentioned you shock lah. Okay, you shock. So that is considered the first actually. The first shock. The number 2 there is actually the first shock. The first defib, betul? The sync cardio version tak kira. It's a cardio version. This one is a defib. So, tak apa. So, orang yang recorder pun kena faham the susunan. The first shock is considered yang 2. That was the first. Okay. The first defib. Okay.
Epinephrine given earlier, so you have to after the second.
You are right. Betul. So, in that sense, epinephrine was given too early. Okay. You remember? Yang VF, yang you defib, pulse DT, yang you defib, you don't think of anything else apart from shock or defib and CPR. Don't think of drugs yet. Okay, apa? That can be improved. Tapi I think I would penalize that like minor error lah. I wouldn't like fail you if you give early. I wouldn't fail, but it's not like 100% lah, tak dapat excellent lah basically. Because too early. Okay.
So AP kena dekat sini, amiodarone dekat sini.
Amiodarone bawah ini. Tapi let's see amiodarone was it given? That's why I was asking. Amiodarone was given after 3rd ataupun 2nd.
I put that last count.
That's why recorder penting tu. Bagi senang nampak. Okay, that is the first. The second one shot is given next. Amiodarone given too early lah. Amiodarone given too early. So amiodarone was after 2nd. So amiodarone also too early. And then the third shot was given right. So actually, if this was a real case, I would pass you, even though you given too early lah. To me, it's just a minor punya ni. It can be improved later. Tapi janganlah buatlah betul-betul kan. Kita practice yang betul supaya ingat sampai bila. So okay, other than that, you dah buat betul. Cuma make sure you cover H&Ts at any time lah. At any time, tak kisahlah. I won't fail you if you ask during BF. Okay, the HNTs, and also make sure you mention your team to your teammate do the high quality CPR. That's the mainstay ataupun the.
Everybody is clear? Okay. Resume CPR, please.
Okay.
So, epinephrine, 1 milligram epinephrine.
Body harder.
Want to give now?
Yes, you can give. 1 milligram. Push harder.
Body harder.
The target here is 5 centimeters. If you are tired, you can shake.
Good
Okay,
compression.
let's say doctor is feeling tired even before the 2 minutes. What can you do?
You can do this.
Okay, do it seamlessly. Okay, I teach you. Tak apa, continue. I teach you how to do it seamlessly. So, doctor kata, okay, I'm feeling tired now. Ready to change. In 3, 2, 1. Switch. Straight away. That's how you do. Okay. Always communicate tau. Okay, aku dah penat ni. Okay, ready? Cakap. Okay, ready to change. Gitu. Okay. 3, 2, 1. Switch orang. Yes. Because we don't want to jeopardize the quality of CPR. Kalau dia dah tired, you cannot just belum 2 minit lagi, not yet 2 minutes, we must continue. Cannot do that. He's tired, so quality is out already. So you must change early. Okay, 15 seconds to 2 minutes. Okay, just recharge. Okay, 5, 4, 3, 2, 1. 2 minutes. Okay, again, charge balik, dah hilang.
Pulse or no pulse?
No pulse.
No pulse, okay.
Okay,
Everybody is
clear.
clear? Shock. No shock, please. Resume CPR.
Okay.
Prepare amiodarone 300 milligram.
Body harder.
Anita, tolong.
Body harder.
Arrange for intubation. Give amiodarone 300. Amiodarone 300 given.
Darong given to the
Body harder. Body harder. Body harder.
Okay, patient intubated. Wow, CPR coach
Body
intubated.
harder.
Terus.
Push harder.
Okay, dah penat ni nak tukar.
Body harder.
Anak dah.
Okay, 15 seconds to 2 minutes.
Body harder.
oh, okay.
Continue.
Kita macam hari aku dah boleh hari tu.
Wait. Okay. 5, 4, 3, 2, 1. 2 minutes start.
Observations. Okay.
Do you feel the pulse?
Yes, there is pulse.
There is no pulse.
No pulse.
No pulse.
Okay, continue CPR, please.
What do you want to do?
Continue CPR and 5 search for reversible pulse. Continue CPR and give second use of epinephrine.
Body harder.
So, now while waiting 2 minutes, what do you want to order? What do you want to do? So you mentioned of epinephrine, right?
Yes, epinephrine and now we'll search for secondary causes because it's
Body
not
harder.
Yes.
Search for 5.
Which are what? Mention. I want you to list down.
Maybe hypokalemia, hyperkalemia,
Yep.
or acidosis, or hypothermia,
Yep.
or hypoxemia.
Yep.
Okay.
Body harder.
Maybe tension pneumothorax, cardiac, cardiac thrombosis,
Yep.
pulmonary thrombosis,
Yep.
hypertension,
Of course, usually when you mention that, that triggers you. How's the blood? That triggers you. What's the EBG like? What's the potassium like? Can we get the echo? That will trigger you to think of those. Okay. Tapi they just mentioned. Okay, pass already lah. Okay. Alright. So let's see. Okay, 15 seconds to 2 minutes.
It's 15 seconds. Wait.
15 seconds to 2 minutes. 5, 4, 3, 2, 1. 2 minutes.
Check the visions. I can feel those.
Can you feel it? Can you feel it? Okay, good. Okay,
Okay, let's continue ventilation, please. Okay. Check BB. Check BB is okay. Connect to the ventilator.
Connected.
You can do the exposure and the search for any instabilities.
Now I want you to show me what you do post RSC care systematically. You just do A, B, C, D, E. Show me. So A.
Airway already inserted.
Yeah.
Okay, breathing. We'll connect the patient to the ventilator. Okay.
And waveform capnography, you must mention. Waveform capnography, yeah?
Even if we have good saturation.
Yes. Waveform capnography is the gold standard.
Okay. Circulation, BB is
BP.
okay now.
Okay. You can check the BP if you want, if you're not satisfied.
Okay.
Let's see.
Okay. There's pulse or no pulse?
There is pulse. You can still feel pulse, right? There is pulse, but it's weak.
If doubtful, we have to start
CPR. Alright, if you have doubt, good.
But he's shocked now state, we can start epinephrine. We start epinephrine infusion, please.
Okay.
Okay, start with 5 mics per minute.
Of course, you can give some boluses, fluid boluses also if you want. Okay.
After checking, we can check with echo from checking.
Sure.
No tamponade, nothing.
Yep.
Maybe the cause of this hypertension. Okay,
Yeah,
start
you're right.
epinephrine.
Okay.
Start 1 liter normal saline.
Okay.
Okay.
What else? ECG. ECG. Usually, I would include blood pressure, ECG together in the circulation. Okay. So ECG, let's say normal. Okay. Moving on. Just complete. D.
Okay. The disabilities we can check for any power lateralization like facility like.
Okay. The number one you can check is the responsiveness.
Okay.
Whether he's awake or not. So you can check, sir, are you okay? Or sir, can you squeeze my finger or anything that can indicate whether the patient is conscious? You can. Okay. So let's say, sir, are you okay? No response. You must show. If there is no response, what you can consider?
Consider brain hypoxemia due to CPR, brain hypoxemia due to CPR, and I have to maintain the circulation. After that, cooling.
Cooling, okay.
Between 32 to 76.
We call it.
In our hospital,
yes, we're missing this, right? It's not well practiced, right? That's what HA said. It's actually under practice. This one, under practice. It is in the.
Must be done.
Yes, I mean it is recommended and it is suggested. It is recommended. IGN have actually.
I think or not practice.
It's up to the hospital protocol, but AHA has been pushing this. Why are we not practicing? 32 to 36. The latest guideline 2025 up to 37.5. But in this guideline 32 to 36 yet. 32 to 36 yet. Core temperature. Rectal boleh. Core temperature. No. I mean, well, as long as it's normothermia, okay already. Normothermia, not fever. Keep the patient away from fever.
We keep this fever with IV
No. PCM. PCM. If the patient fever, paracetamol.
No, I mean if I want to cool.
Cool. Okay, cool have got many devices. Ada cooling devices, ice packs. IV saline ada juga, cold saline ada, there is. But ice packs at the center, at the armpits, the core, in between the groins, cool down the patient. Okay, what else?
Shift to expose the patient for any trauma, for anything.
No trauma.
Nothing okay. We can shift to critical care area.
Okay.
ICU or CCU.
Okay, great. Okay, so that will be your complete script lah. That will be the script for the examination today. Itu complete dia. Okay, boleh ikut. Okay, boleh ikut. Ada soalan? Okay, should be okay. Okay, sudah. tak apa. Memang it's a bit technical. Tapi you try je. Okay. Kita aja kan. Okay, good. Alright, well done. Okay, any other feedback from yourself? Anything maybe you can share with us?
As usual, great team.
Very good. So, okay, let's see. Okay, just turn it off. Let's see the algorithm. I think okay, straightforward. Okay, everything is spot on. I think shock, shock after second, epinephrine after the second, amiodarone after the third. How many shocks are? Why?
Four.
Four times.
Four, yes. 4 times. So we give 3.
Yang atas tu actually pulses rate is not the rhythm first one.
Actually, I memang bagi pulsatility pun throughout. Memang pulsatility pun. Semua memang pulsatility, tapi I was 3 times tak apa. I got lost also. Semua pulsatility. Okay, so if you remember, 4 times as a method. Okay, amiodarone 300. Okay, you can consider 150 after the 4th shock. After the 4th shock too, you can consider 150. HNTs you mentioned, high quality CPR you mentioned. Usually, I would say the high quality CPR early on. Usually, when CPR just started or early on, make sure CPR must be good. High quality what? Depth, mention. Okay, what else? Clear.
Clear. Everybody.
Shock.
Resume CPR. Itu je. Tak ada benda lain dah pergi. Okay. Now you focus. 2 minit banyak masa. What do you want to do now?
Okay. Sekarang kita check for the irreversible
Push harder.
cause, which is 5S and 5H, 5T.
Okay.
First, hypoxic, hypovolemic,
Push
hyper
harder.
and hypokalemia.
Okay.
Push harder.
Hydrogen.
Okay.
Okay. Hypothermia. Okay.
Push
Then,
harder.
untuk yang 5T is cardiac tamponade,
Okay.
oxytocin, pulmonary embolism,
Okay.
and coronary thrombosis and
pneumothorax.
Okay.
Okay. 15 seconds to 2 minutes.
Okay, prepare for the switch.
You fikir tu je, recharge je. You fikir recharge.
Push harder.
You can also, tapi I want you to know. Recharge, you put your hand on the pulse.
Okay, pre-charge.
Put your hand on the pulse. 5, 4, 3, 2, 1. 2 minutes up.
Okay, stop.
Switch. No pulse.
No pulse.
Rhythm.
Rhythm is VF. So
Clear.
Clear. Everyone clear?
Clear.
And shock.
Yes.
Okay, resume CPR. Resume CPR.
Dapat tak perasaan tu? Kenapa dia perasaan?
Tak turun
It is real current. It is real current. It is real current. Because it was 200. Dia tak bermasalah. Memang mesin ni boleh handle. Tapi I tak nak accidental. Confusion. Itu je. That's why dia boleh handle. That's why I ask. Macam tu. Real patient pun memang akan bau hangus. Kalau
When we switch one coming in default to 200,
200, it was 200.
I mean the default.
Yes.
The default is 200. Default is 200.
That's why.
Default is 200.
Because before we hit it,
Yeah.
Oh,
Turun guys, that's why I asked to reduce. But it's not a problem. Memang real life pun macam tu. That's why you need to clear. Okay, good. Apa lagi?
Okay, meanwhile maybe kita boleh intubate patient.
Okay, tak apa. You bagi arahan je. Okay. Okay, I nak fast forward. 15 seconds to 2 minutes.
Okay, charge.
Okay, nice. Bau. Okay, put your hand in the pulse.
Prepare for the
5.
switch compressor.
Oh, okay, 4, 3, 2, and 1. 2 minutes.
Stop CPR. Stop. Okay.
Rasa tak?
Ada. Got pulse.
Okay.
So ROC.
Okay.
Okay, ROC.
What do you want to do now? Okay, kita cepat.
Anyway, kita connect dengan ventilator.
Okay, intubate dulu.
Okay, intubate.
Okay. Make sure it's intubated lah. Okay.
And then kita check for the response patient.
Okay, waveform capnography. Jangan lupa, masih sebut perkataan tu.
Okay, on a ventilator, put on waveform capnography.
Okay, baru move on.
And then
Okay,
kita
kalau
check-
boleh mention SPO2 lah. SPO2 berapa nak target? Masih
Okay,
SPO2.
SPO2 92 to 98%.
Okay, now move on. C.
C, check for the responsive patient.
Gan.
My circulation.
Circulation.
TTM. Yeah.
Aduh, kan?
All the pressure.
Ah.
Okay. Blood pressure. Make sure systolic dia more than 90.
Okay, now it's what?
137 over 101. Maybe check balik.
Okay, lagi. Okay.
Okay. And then ya, kita buat carefully ECG.
Normal lah, normal. Fast forward je ni normal.
And then
We'll check your ECG, check your heart rate now. Just rest for a while. Checking.
aduh, sikit je.
Tekan BP sekali, check BP sekali. Yeah,
Okay.
yeah. So
Agak lain
patient
lah, alain saja. Nampak lain.
patient is having belly. Patient in failure to stop. Of his unstable breathing.
Right, good.
So unstable ready. So I start with medication.
Like what?
Like atropine 1 to 3 mg.
Amina is inserted. 1 mg atropine is given.
So
given, so the same.
still observe for a while, still the same.
Same.
So can proceed with the second atropine 1 mg again.
Yeah, 1 mg atropine given.
And standby 1 more mg.
Okay, patient. SPO2 berapa ni? SPO2 dia let me see. Okay.
Can prepare oxygen. Patient.
Face mask tu.
Face mask to use. SPO2 92. Top up the patient.
Okay, so still the same after the
Still
second
the
1 mg.
same. Proceed with the third mg. Then
1 mg atropine
One.
is given.
Okay.
then can prepare for infusion adrenaline. And BP now is 60 over 34. Then we proceed with the TCP pacer.
Okay. Patient is now fitting.
Patient is now fitting. Check the pulse.
No pulse.
Pulse field. So start with CPR. Bending patient.
Morning harder. Morning harder.
Prepare adrenaline.
Push hard.
Push hard.
Okay, what are you dealing with now? Is it asystole? Was it asystole? No pulse, is it asystole?
Pulseless T.
Okay, so what do you want to do?
Charge. And then charge. Defeat patient. All clear.
Clear.
Then
Clear.
all clear. Defeat the patient ready. Resume CPR.
Okay.
Resume CPR.
Morning harder.
Push harder. Check the quality of CPR.
Okay, which is?
So push harder and fast. Rate is 120 and the depth is 5 cm. Allow fully recoil. And then minimal interruption, less than 10 seconds. Avoid excessive ventilation and maintain the CCF at least 60%. Ideal is 80%.
15 seconds to 2 minutes.
Check the pulse charge. Continue CPR.
5,
Pulse.
4, 3, 2, 1. 2 minutes.
Ready
Switch.
for switch. No pulse.
Breather. You can see behind you also. Okay. Side.
VT. Pulseless VT.
So what do we do?
Defeat operation.
What yours? Clear. You say clear.
Clearance deposit.
You say
Clear,
clear.
everybody. Okay, shock.
Shock.
Clearance by the coach or by the team leader?
Resume CPR.
I think
I think for exam purpose, team leader lah. Because
If
team leader, because here it says
now,
clear before shock, clear before analyze and shock. So team leader must say clear before analyze and shock.
One entry ada tadi given. Given prepare for intubation and then check for any reversal cause.
Okay.
5H and 5P.
Sebab nanti masa exam I will be really quiet. I would just say the vital sign ke, the condition of patient, maybe I would just tell that. Kalau you just proceed whatever it is, I wouldn't fail you yet lah. I mean, because the outcome would be still the same. Because the effect. Okay, if I see that team members keep prompting you, meaning you're not mastering it yet. Kan? Because everything must come from team leader. Show that you know. Show me that you know your stuff. So everything must be corrected by team member. Alamak, macam tak ni je kan? It's not competent yet. Doesn't say. Sikit pun okay lah, I give discount. Okay, other than that should be okay lah. Kan? Tak ada apa-apa yang pening. Everything clear. Dia punya flow pun nampak dah cantik. Alright, that's all. Any questions from everybody? Okay, sudah? Okay, kita try tak? Tak apa, nanti kita have a word. Okay, I want to show. Just pass me the book. Itu the 2020 ke 2015 ya? 2020. Nampak dah bracket. 2020. I want to show. Memang tadi doktor ni tanya, Ahmad was asking regarding okay. See 2015 and 2020 regarding ventilation. You want 30 compression to 2 breath before intubation, or you want to do the asynchronous 1 breath every 6 seconds and continuous even without the ET2. So you see 2020 ventilation 1 breath every 6 seconds for respiratory arrest with or without an advanced airway. Okay, and also for cardiac arrest. Sama lah cardiac arrest yang tadi. With an advanced airway, if your lung rate is continuous compression and asynchronous ventilation only. So can. So with that. With continuous compressions and asynchronous ventilation for cardiac arrest. So meaning it's still allowable. It's still allowable if the hospital protocol allows asynchronous. You can. Yeah, so that's what we've been told. But of course, if intubated, clear. Okay, 1 breath every 6 seconds. So, yeah. This is it. Without back mask device if your okay. Use this rate with a back mask device if your local protocol is continuous compressions and asynchronous ventilations for cardiac arrest. Asynchronous ventilations, same. So okay, and anything else before we move to MCQ? Okay, apa lagi soalan-soalan bocor? Tapi basically dia tanya rhythm tau nanti. Dia bocor rhythm strip and then what is this? Kita rocker, open book kan? Open book. I think you can. Open book cari lah. CPR coach. What's the role of CPR coach? What's the role of CPR coach? What's the role? Yes, BLS, effective CPR tu to focus on the BLS part or the CPR part, the quality CPR part. Tu main focus of CPR coach. Maintain high quality CPR.
What's meant by limitation?
Knowing limitations. Yalah, for example, if the team member says that, oh, I cannot intubate, I cannot maintain airway, I'm not skilled enough, I'm not trained yet. So you must inform the team leader, and the team leader will change. Meaning you yourself as team member, you said, can I get a new role please? Maybe like giving drugs, maybe CPR, compression, maybe just shocking. And depends. So you ask for a new role. That means you know your limitation, but ask for a new role. Do not pretend you know your stuff, and then you can be really dangerous for the patients. You can give wrong drugs, all those things. If you see somebody is about to give wrong intervention, what do? Stop. intervene straight away. Do not wait. Nantilah wait until the briefing nanti later lah. Do not now intervene now. I heard adrenaline not atropine. You're giving atropine now. Change. Double check with your team leader. Okay. I think that's about that. The concept I think is quite clear. Okay. Good. Okay. All the best for the MCQ. And proceed to lecture. Toilet break boleh lah. Kita bagi 2 minutes. And then after that, come back. Yeah. You can. So, how's everybody? Hey. Okay, guys. So we have reached the end. This is the results. Can you see the results? Okay, we're going to zoom in a little bit. Okay, so basically, alright. See your IC number. Okay, and then the results for today, yesterday and today is this side. Okay. Alright. So basically, mega code all pass. Only one is verification. And MCQ, there are 3 red colors there. Okay, that one, those red colors must stay back after this. Okay, with a bit of remediation. Okay, but congratulations to the others as well. Okay, for all of you. Okay, so, okay. So everybody say that. Oh, tak nampak. Oh, sorry, I saw that. Okay. Okay, let's just do the closure part. So, by now, participants should be able to actually apply the learning objectives that we said earlier on, yesterday. The basic life support skills, the primary assessments, the secondary assessments as well. Recognize the early signs of ACS, respiratory distress, respiratory failure, and the management. Okay? And of course, ACS including stroke must be recognized early in order to be treated early for better chances of survival. And remember the algorithms as well, especially today. So how was your mega codes? Okay, all had competition already lah. Okay, so good. Bradycardia and tachycardia, you know your weapons, you know when to give this, you know what's the maximum you can give before getting the expert help. Okay, and cardiac arrest algorithms as well, shockable, non-shockable. Okay, so make sure as team leaders and team members, you play important roles. Each one of you are important. Know your roles, know your limitations, inform early. Okay, and ask for new role if you're not skilled to do any of this. Okay, so in order to achieve all that, you actually have to find a cohesive way of application of this chain of survivals. Make sure one chain is linked to the other chain in order to make sure survival is maximized. Okay, kita tak nak macam CPR just macam tu saja. Lepas tu dah penat tinggal. So quality pun tak monitor. No more of those old school punya tak nak. Kita dah new age. Okay, kita mesti improve kita punya quality of CPR. Okay, early recognition of life-threatening conditions and arrest, and systematic approach promotes structured assessment because, as you know, things can be messy. So always go back to A, B, C, D, E's in order to get everything done and intervene structuredly. Alright, high quality CPR and early defibrillation is paramount. Okay, and you need to be, all of us need to train and again retrain to be part of high performance team in order to maximize survival. Okay, because life is why. That's AHA punya motto lah. Okay, because life is important, that is why. Okay, any questions before we leave? No, any feedback from the floor? Okay, just any feedback? Tak ada? Nak protes ke? Tak setuju dengan markah ke? Tanah risky ke? Okay, this is all for patients good lah, and for all of us punya performance. Okay, with that, I thank you very much. Okay, from the CPR faculty team, the secretariat, and the instructors. Okay, we thank you. so much for your participation. It's been a great 2 days. Okay. Siapa yang tak habiskan feedback kawan-kawan dalam kita orang ni, nanti we'll look at and try to improve ourselves. Okay. Dah tu je. Okay. Anybody? Any comments? Semua boleh? Nak ambil gambar ke? Kita ada bang. Miss Sister. Gambar. Jadi kita kumpul dekat sebelah, kita ambil gambar. Right. Siapa yang belum buat? Siapa yang nama tu abaikan. Just scan je. Okay. Certificate, I think by tomorrow already. Sebenarnya by end of today pun dah ada lah. Okay. They will email lah. Ataupun you remember the link kan? I can pass the information. Okay, so kita ambil one quick picture all together. Pass.